Good afternoon, Ms. Wachida. It's nice to meet you. I am Dr. Amiraina, one of the physicians in this hospital. Before we get started, I want to make sure you're comfortable.
Yes, Doc.
So I'll be asking you some questions to better understand what's going on and how we can help. Does that sound okay?
Yes, Doc.
So, how are you feeling?
I've been feeling sick for the past few days. I think I might have the flu.
I'm sorry to hear that. When did the fever start? Can you tell me more about your symptoms?
It started a few days ago with the sore throat and chills. Then I developed a fever and now my whole body aches. I also have a bad cough.
I see. Have you noticed any other symptoms like nasal congestions, headaches, or shortness of breath?
Yes, my nose is a little stuffy and I've had some headaches, but I'm not short of breath.
That's helpful to know. Have you been around anyone who's been sick recently?
Yes, my sister was sick last week and I think she had the flu.
That might explain it. Have you traveled recently or been in any crowded places?
No, I've mostly been at home studying, but now with this disease, even getting out of bed is hard. How am I gonna take the board exam? I feel completely drained.
I'm sorry you're feeling this way. It really is a problem. I understand how you feel with the board exam and your flu. It might affect how you study and thus the result of the board exam. Thank you for sharing all of this. We're here to help you. Let me summarize what you have mentioned. You had a fever, body aches, a cough, and fatigue for the past few days, along with some congestion and headaches. Does that sound correct?
Yes, that's exactly it.
So, based on what you've told me, it does sound like you might have the flu. I'll do a quick physical exam to check your vital signs and listen to your lungs just to make sure there's nothing else going on. Then we can discuss treatment options. Does that sound okay?
Yes, that works for me. Thank you.
You're welcome. Do you have any questions or concerns before we move on?
No, I just want to feel better soon.
I understand. Let's take care of this together.